Hydro implantation of intraocular lens is a comprehensive guide. There is no financial disclosure. Ophthalmic viscosurgical devices were first introduced to maintain space in the eye during the implantation of intraocular lenses. With the development of different types of ophthalmic viscosurgical devices, additional indications like protecting the corneal endothelium to enlarge and stabilize the size of the pupil in small pupil or intraoperative floppy iris syndrome are developed. On the other hand, complications like post-operative elevation of intraocular pressure, capsular bag distension syndrome, toxic anterior segment syndrome, and post-operative IOL rotation, especially in toric IOLs, which leads to reduced visual acuity, have been reported in studies due to use of ophthalmic viscosurgical devices. Furthermore, the use of OVDs lead to an increase in the surgical cost and duration of surgery, also reported in the literature. However, all the studies and literature have reported hydroimplantation of only single-piece intraocular lenses. In this video, we will show the hydroimplantation technique using different types and designs of IOL. Plate loop or Rayner designed dual haptic monofocal hydrophilic foldable IOL, butterfly cartridge and suture injector. Hydroimplantation of these types of IOL can be performed by continuous irrigation through anterior chamber maintainer or irrigation cannula of phacoemulsification system. Carefully load the IOL into the butterfly cartridge under the view of microscope. Ensure the lens is properly seated in the cartridge and verify the haptic trap, avoiding any potential breaks. Insert the tip of the cartridge through the incision, maintaining careful control to prevent a fluid leak or a shallow anterior chamber. Gently glide the IOL into the capsular bag, ensuring the haptic and optic opening smoothly, following the guidance of the dialer. C-loop designed trifocal toric hydrophobic foldable IOL, wound assisted IOL delivery, butterfly cartridge and suture injector. Load the IOL in the cartridge and check the entrapment of IOL haptic under the microscope. For wound assisted IOL delivery, the tip of the cartridge is placed at the entrance of the corneal incision, which is of the same size as the cartridge. Then push the IOL with a plunger without entering the tip of the cartridge inside the anterior chamber. With the help of dialer or Y-hook or irrigation cannula, guide the IOL in the capsular bag. While performing hydroimplantation, the bevel of the anterior chamber maintainer's tip should be upwards towards the cornea or the anterior chamber angle. If you are performing hydroimplantation with irrigation cannula of phacoemulsification system, the port should be horizontal and parallel to and above the iris plane. Preloaded hydrophobic monofocal IOL. The lens comes pre-packed and is designed for ease of use. Prepare the injector, ensuring that the IOL is correctly loaded and ready for implantation. The preloaded design minimizes the risk of contamination. It's essential to ensure that the incision is appropriately sized. Gently insert the preloaded IOL through the corneal incision with one hand till the trailing haptic comes out from the cartridge and guide the IOL into the capsular bag. Properly center the IOL and do the anterior chamber wash. Single piece hydrophobic EDOF IOL, 1 MTEC 30 cartridge and unfolder platinum series screw injector. Ensure the corneal incision matches the 2.2 to 2.4 mm lumen size of the cartridge for seamless insertion. Load the IOL into the rear loading cartridge as shown, securing it firmly into the groove of the screw injector. Push the plunger to carefully position the lens and eliminate any surplus viscoelastic material. It requires two hands for the screw injector to insert the IOL, so hydroimplantation is done only by using an anterior chamber maintainer and thus not possible to use an irrigation cannula or phacoemulsification system. With the injector held in one hand, insert the narrow tip of the cartridge through the incision. Use the other hand to initiate the clockwise screwing motion, gradually inserting the IOL into the eye. As the trailing haptic emerges, guide the IOL using the dialer or Y-hook into the bag. Plate haptic trifocal toric IOL preloaded cartridge Blue Mix 180 injector. Ensure the corneal wound matches the 1.8 mm size of the cartridge for seamless insertion. Load the cartridge into the Blue Mix 180 injector for demonstration of smooth delivery as shown in the video. Push the lens using the plunger till you hear a confirming click sound indicating proper locking. With one hand on the injector and the other on the dialer, gently glide the IOL into the capsular bag, ensuring proper opening of plate haptic. Tap the optic to ensure proper placement of trailing haptic. Clean the IOL surface using an aspiration cannula and center it within the eye. 3-piece hydrophobic foldable IOL Emerald C30 butterfly cartridge and unfolder Emerald series screw injector. The cartridge 2.8 mm lumen size necessitates a corresponding corneal incision. Begin by securing the IOL at the distal end of the cartridge within its case as so demonstrated. Slide the IOL into the cartridge groove, aligning it with the image on the leaf. Securely fold the leaves and load the cartridge onto the emerald injector. Place the trailing haptic of IOL outside the track of the injector and push the IOL with a plunger towards the tip of the cartridge. Ensure perfect alignment of the plunger and IOL indicating by confirming click sound. Initiate the clockwise screwing motion to gently push the IOL towards the tip of the cartridge. With one hand holding the injector, carefully insert the cartridge through the incision. Guide the leading haptic parallel to the iris plane into the bag. Rotate the cartridge gently, releasing the IOL optic into the bag with a gentle to and fro movement, and withdraw the plunger a little bit. Follow by pushing the trailing haptic directly into the bag. Hope this video gives you confidence in doing a hydro implantation of different types of intraocular lens and empowering your skills in cataract surgery. Thank you.